takes away a woman's ability to access joy at the time she needs it most. What I'm referring to is postpartum depression. Postpartum depression is a disorder or illness that affects many women after giving birth to a newborn. Postpartum depression is often underreported and underdiagnosed. According to the Cleveland Clinic, 50 to 75% of women experience what is called baby blues. Baby blues could mean like a woman's feeling sad, feeling irritable, maybe loss of appetite, but not necessarily so serious. You could also attribute these things to lack of sleep, which also comes with having a newborn in the house. 15% of these women go on to have postpartum depression, which is a very serious disorder. Postpartum depression, like I said earlier, is often underdiagnosed, underreported, and women often feel that they may feel that they're embarrassed to speak up, or they're so involved with taking care of a newborn during this joyous time that's supposed to be joyous, but maybe they're not feeling so well, but they don't report their feelings as they should, which we need to make this illness. We need to bring this illness to light and talk about it so women can advocate for themselves and feel comfortable discussing these feelings. Postpartum depression has been around for many centuries. It is something that affects many women. It does not necessarily affect women that have a history of depression. However, if a woman has a prior history of depression, there's more of a chance that she will go on to develop postpartum depression. So they should be closely monitored in a clinical setting if you have a history of this. But like I said, it does not mean that you have to have a history of depression to go on to have this disorder or illness. Postpartum depression, some symptoms include feelings of loneliness, sadness, feeling like you can't take care of your newborn, feeling like you can't take care of yourself, just feeling extremely down. And this is a time where you're supposed to feel so much joy. So feeling all these things, lack of appetite, there's lots of things. Anxiety plays a part in it. These things are important to women that have just had babies to understand. Some of this is okay, but to an extent where you're just feeling like you can't get up out of bed, you can't take care of your newborn, that's not okay, and that needs to be clinically treated, and a professional needs to diagnose and assess you. There are many treatments for postpartum depression, some of which include therapy and medicine. A lot of times therapy and medicine combined have a great effect, much more of a greater effect than just say taking a medicine and not having the therapy, but the two combined have been shown to have very positive results. It's very important for your physician clinic to assess you during your pregnancy. Another thing that's important is to follow people that have a history of depression. So there's certain forms that one can fill out, just kind of assessing the feelings, how you're doing throughout the pregnancy. So there can be a wide range. There's a wide range of variability, and then after delivery, it can be assessed. If it's gone one way or the other. It's called an EPDS, and it's just it's a questionnaire, and it assesses your mood and anxiety level. Oftentimes, having a baby is a very anxious time, where it should be a joyous time. Lack of sleep, like I said, can attribute to some of these things. But if it's excessive crying, excessive inability to sleep, or inability to take care of yourself and your newborn, feelings of just extreme sadness, those are all very big concerning red flags. And also, this disorder is overlooked, underdiagnosed, because like I said earlier, women just don't feel like they're giving their all to their newborn and not to their own feelings. But that's so important in all of this, because if mom isn't feeling right, then how is she supposed to take care of the baby? So it's a whole thing, and hopefully by bringing awareness and having some treatments out there available, there's many medical treatments, pharmaceuticals, taking with therapy. I know in these strange times it's hard to go to therapy. However, there are telehealth therapies, so Zoom, what have you, can be very helpful to a mother at home, which is actually, in my opinion, a little bit better because she doesn't have to drag the newborn out of the house and can just log onto the computer and have a great therapy session with someone. So bringing this illness to lightness is a passion of mine. I work in an OBGYN clinic, and I just feel like it should be talked about. Women should not feel ashamed or embarrassed to speak up and advocate for themselves to be able to care for their newborn as they should.